Uh, this afternoon, we have Maria Iriarte, Senior Attorney from Disability Rights California, to talk about transition planning to adult services involving the school district, regional center, and Department of Rehabilitation, so your child can plan for their future. First, we just want to briefly talk about the Family Resource Center and what we do here in San Mateo County. The FRC of San Mateo serves families who have children with disabilities or between the ages of 0 to 22. We are staffed by parents and caregivers of children and young adults with disabilities and provide support, information, and resources, as well as referrals to navigate the systems out there. We also offer trainings like this one, support groups, a resource finder, and a monthly e-newsletter. I want to give a disclaimer that the Family Resource Center is not a legal firm or legal service agency, and we cannot provide any legal advice. Any information provided by the Family Resource Center should not be considered a means of taking the place of legal advice that must be obtained through an attorney. We invite you to connect with us, and we'll be sharing our contact information in the chat as well. I also want to introduce our Family Resource Center staff. My name is Denise. I am a coordinator with the FRC. Here with us is Patricia Edrulo, our FRC supervisor. Next, I wanted to go over some general housekeeping items to make sure our training this afternoon runs smoothly. Like mentioned, we are recording this training for any families and providers who weren't able to attend this afternoon. So we please ask that you please mute yourself when not speaking to avoid background noise. You can have your video on or off based on your preference and comfort level. And please be respectful throughout this training. We are offering simultaneous interpretation in Spanish today. So if you haven't already, please select the language that you would like to listen this presentation in. You can select it in the settings bar under the global icon and click either English or Spanish. If you are listening to this presentation in English, please still select English in the settings. This will allow you to hear the interpreters translate from Spanish to English. We are also offering live automated captions today. If you would like to view the captions, go to the Zoom settings bar, find the CC icon, and click on the Show Captions. We will have a QA portion at the end of the training, so please save your questions for the end. We encourage you to take notes and write down any questions as they come up so you don't forget them. You can also use the chat box or raise hand feature for questions and comments during the QA portion. We encourage you to refrain from sharing names or detailed information to protect your and other families' privacies. After you ask a question, please be mindful of making pauses to allow the interpreters enough time to translate both the question and the answer. At the end of this training, we will be distributing a survey both in English and Spanish to collect your feedback on how the training went. This will be anonymous, and it helps us understand how to improve our trainings for all of you. And lastly, we will be sending a follow-up email tomorrow with all the materials shared this afternoon. And now with that, I'll turn it over to Disability Rights California. Thank you everyone for being here this afternoon.
Thank you, FRC. And thank you everyone for being with us this afternoon. My name is Raymond Kwong. I am an advocate with Disability Rights California. And with me today, I have Leilani Pfeiffer. She and I will be supporting our presenters today. It's my senior attorney, Maria Iriarte, our senior advocate, Mari Cruz Magdaleno, and our staff attorney, Emily Ikuta. So just a quick intro overview of our agency for those who might not know who we are. Disability Rights California, we are a statewide nonprofit agency, and we provide free legal services to people with disabilities with any disability-related issues. We have offices statewide, with our headquarters being in Sacramento, and we have offices in Fresno, Oakland, Los Angeles, San Diego, Ontario, just to name a few. We have attorneys and advocates who can help with a variety of issues, from access or discrimination issue with housing, with transportation, with education, which includes special education and higher education in colleges and universities. We can also help with employment accommodation issues. We can also help with public health benefits, such as Medi-Cal, in-home supportive services, and Social Security overpayment issue that relates to work. And within our agency, we have separate programs, such as Office of Client Rights Advocacy, or OCRA, that specialize in helping clients of the regional center, and our Client Assistance Program, or CAP, that specialize in helping clients of the Department of Rehab. So, as our host just said, we will have Q&A at the end of the presentation. If you'd like to speak to us, one of our advocates, make an individual private appointment, you can, of course, reach out to us. I will be putting our intake line in the chat, along with our website, if you'd like to review our publication. Our intake line, for those who don't have access to the chat, is 800-776-5746. So without further ado, I'm going to pass it over to our presenters, and I will show the PowerPoint. Thank you.
Thank you, Raymond. Thank you, FRC, for inviting us to present an important topic, really, transition services, and the role that the school district, the regional center, and perhaps the Department of Rehabilitation can play in the transition planning and providing transition services. So next slide. So when we're talking about transition services, what are we talking about? What is a student going to do after the student leaves the school system? Do they have a vocational goal? What services and supports are going to be needed to be able to participate in the community, to go to school? Lots of things, just like we all think about what we're going to do with our lives. This is what transition planning is. And we have three potential agencies involved in the transition planning. The school district, of course, for students with disabilities, ages 3 through up to 21. We have the regional center system for consumers of the regional centers. Typically, people become consumers of the regional center at age 3. Sometimes it could be before the age of 3, but typically regional center consumers begin at the age of 3. And then we have the Department of Rehabilitation Services. They provide pre-ETS services for students with disabilities who are thinking about a vocational goal. Next slide. So we're going to talk about transition planning. We're going to talk about the types of services you could get through the school district, and how to plan for that. Services you could get through the regional center if you have a vocational goal, the pre-employment transition services that are available to students. And you'll notice that under school district, it has IEPs, the individual education plan. That's the contract between the school and the parent/student. The regional center also has a contract, and that's called the individual program plan, the IPP. And the Department of Rehabilitation also has a contract, which is called the individual plan for employment, the IPE. So anyway, just a funny thing, we have so many acronyms. So we're going to talk about these systems and the services available. And at the end, we're going to talk about how do you deal with disagreements and hurdles, especially when you might be dealing with 3 agencies at once. Next slide. Planning for the future. So let's go. One thing that Emily's going to talk more about is competitive integrated employment as an option for a vocational goal, right? What does it mean? It means real job, real wages. The person with a disability makes at least minimum wage and is working with people that do not have disabilities and have the equal opportunities to advance as people with disabilities. It is an option for people with disabilities. I want to say when I do my training on SSI, I start off by saying that there are many, just because you are disabled does not mean that you cannot work. There are many people with disabilities who are working. And in fact, I know one of the reasons why people never think about work when they're especially receiving Social Security benefits is that they're afraid to lose the benefits. Maybe it took them a lot of effort to get those benefits, and the last thing they want to do is jeopardize the benefit by working. But I want you to know that Social Security publishes, it's called the Red Book, it's a manual, and it talks about all the work incentives for the SSI program, Supplemental Security Income Program, the Social Security Disability Insurance Program. So yes, you can work. You have to know what those work incentives are. So down the line, you're not surprised by something you may get from Social Security. And so we're putting the link in the chat for the Red Book. The other thing is if you are receiving Social Security benefits and you're working and have not received counseling about how working will affect your Social Security benefits, or if you are not working but you are on Social Security and you do want to work, I highly encourage you to reach out to what are called WIPAs. It's the acronym stands for Work Incentives Planning Assistance, I think. Throughout the state of California, in every county, there is someone who's been certified by the Social Security Administration to provide counseling. What's going to happen, if anything, to your public benefits, of course, including Social Security, should you go to work. And we're going to put the website for the WIPAs in the state. And if you want that type of counseling, it's free. You can contact the person in your county, make an appointment, sit down and talk about what your plans are for work. They're going to need information from you, and they'll tell you what information it is that they need, and they're going to give you in-depth counseling. And the good thing about it is that, let's say that I've done it. I've gone to a WIPA, and now I understand, how working and earning this kind of money is going to affect my benefits. And let's say 5 years down the line, I'm promoted. That means I'm going to get more money. And I'm like, oh, I don't know. I'm kind of concerned about how this is going to affect my benefits. I can reach out to that WIPA, maybe hopefully that WIPA is still there, or maybe the person who's replaced that WIPA in that county, and continue the conversation. I can call him or her and say, hey, I was a client of yours back in 5 years ago, and now this is happening. Can I meet with you and talk about what this means for me and my public benefits? You really need to know, you do not want to be surprised by a letter that says your benefits have been terminated. It may be a good thing that they're terminated, because that means that you're probably earning more than you would be getting in SSI or even SSDI. So, but you need to know, right? It's good for you to know, so there are no surprises at the end. So those 2 links are there, the WIPA and the Red Book. Next slide. And say yes to high expectations. You can do it with the right supports. People with disabilities can be good at all kinds of jobs. It's happening as we speak. Set goals that you can achieve. There are options. Expect to work hard and believe in yourself. So, you know, remember, set high expectations for what you want to do. And I'm talking about the student who's going to, you know, at some point leave the school district. Well, what's going to happen with what is it they want to do? Do they want to go to school? Do they want to have a vocational goal? Do they want to live in the community? Do they want to learn things? What is it that they want to do with their lives? Next slide. So a good transition plan is specific to the person, to the student. Goals are concrete, achievable. There are realistic timelines. It reflects the choices that the student wants to make, reflects high expectations, realistic also, and the supports that are going to make it happen. And of course, not only timelines, but also it is dates for review as you're moving along your plan. Next slide. So tips for drafting transition plans. And by the way, just so that you know, you're going transition planning under the law starts at age 16. So you can ask for a transition planning meeting with the district and invite the regional center to be part of that transition planning. And if you have a vocational goal, you can also ask for Department of Rehabilitation to be at the table at this transition planning meeting. What is it that the student wants to do? Competitive employment or some other type of employment? Go to college, live in the community. Identify the people who can assist or the agencies who will assist to reach those goals. Be as specific as possible as to the role every agency will have, specific timelines, and importantly, also, if a service is denied, ask for a written notice of action, which should also include your rights to appeal. Next slide. So now I'm going to hand this over to Mari Cruz, who is going to talk about the role of the school district in the transition planning.
Thank you, Maria. So we're going to start talking about the Individualized Transition Plan, ITP, which should become part of your IEP by the time you turn 16. So if the school is not starting this process to develop your ITP plan, it is okay to ask for it. You can also ask to invite anyone you find pertinent, and also all the agencies that are going to be working with you as you enter into adulthood, and that could be the Department of Rehabilitation, and it could be the regional center. So you can invite them yourself, or you can ask the school to invite them to participate in the developing of the individualized transition plan. This plan describe your strengths and interests, and it includes measurable goals, the services and the supports that will be provided in order to help you achieve those goals, and it is based on the assessments. If the assessments that you have does not have the information or that would help to develop this plan, or you disagree with the information that it's on the assessments, you can ask for an independent evaluation from the school. And what that means is that you would basically be requesting a second opinion. You would be asking the school district to fund an outside assessment done by a person that does not work with the school, it's not affiliated with the school, and that the school would pay for. Next page. Okay, so the transition plan, it's required to have goals as the first part of the plan, and those goals should be focused on employment, education, independent living, and it could have all of these areas, or if necessary, again, it should be all focused in your areas of interest. It should also include activities, and that would be instructional services, community experiences, employment related objectives, and related services. And what we know as related services is all of the services that you are getting under your IEP, they will continue through the transition plan. And those are services such as speech, occupational therapy, career guidance, transportation, counseling, and any other service that you might be getting during as part of your education program. Your plan can also include independent living skills that can help if you need practicing activities like preparing meals, shopping, budgeting, maintaining a home, paying bills, grooming, using public transportation. Again, this should all be tailored to meet your needs. If you need help identifying what are the services that you need, or the goals that you want to be included in your plan, you might request a functional evaluation. And this kind of evaluation can guide the services that you're going to receive, or it will help to draft the IEP to meet the ITP to meet your needs. This is a template of an individual transition plan. And so the school is required to provide services. And so as we can see here on this sample, the first part, it says age-appropriate transition assessments were used, and there is an option to answer yes or no. And so if the school have not conducted the assessments necessary to draft this document, that would probably be the first step and the first thing they need to do, start by conducting the assessments. And in that first box, the school should describe the results of the assessments. Then we have upon completion of school, I will, and that's where the goal is going to be written. And it also asks about what services, activities, and supports are going to be provided in order for you to reach your employment goal. If community experience is appropriate, it's going to be described what that activity would look like. And again, all of the related services should be listed there as well. This is the continuation, and it's pretty much includes the same thing. What are you wanting to accomplish? What is your goal? And what services and supports you're going to receive in order to reach that employment, that goal. I am going to now pass it on to Emily. She's going to be talking about the regional center.
Thanks, Mari. Hi, everyone. She had relate, I am going to be covering the regional center's role in transition planning. So first off, just want to emphasize that for services that you get from the regional center, and that's for any services, not just transition services, you have to go through the individual program plan, the IPP. So just as there's the IPE with the Department of Rehab and the IEP with the school district, the regional centers area of service planning, where you have to go through this to set things up, is the IPP. But what is the IPP? Well, the IPP that is usually going to be a document that you or your child that lays out the goals as well as the services needed to meet those goals. Now you can ask for an IPP meeting and actually request adding transition related goals or revising or updating them as need be. So like, I would like a goal to work in a competitive integrated employment. I have a goal to live in a community or to go to college. Now, that being said, there are some restrictions on certain services for transition aged individuals. And I'm going to go more into that, but just giving you a heads up. Your service coordinator, who connects you with the regional center, they can help you in advocating for services that you feel you want or need from the school or the Department of Rehabilitation. And the regional center is also supposed to help you in getting the service, trying to get those services together, coordinating with agencies like the school district. So the regional centers are supposed to really prioritize access to opportunities to be able to work. And in fact, this is reflected in the law itself. So the laws that created the whole regional center system are called the Lanterman Act. It's a series of different statutes, and it's under the Welfare and Institutions Code. So if you're wondering what that WIC means, that's just the full name of the name of that statute, Welfare and Institutions Code. And so the law straight up says the California prioritizes increasing opportunities for individuals like you or your children who have developmental disabilities to get involved in integrated competitive employment, regardless of the severity of their disabilities. So that means that your planning team, the team that you discuss services with through the regional center, they should consider those competitive integrated employment options as the first option once you are of working age. Now, that being said, if you're like, I have other goals, I have other objectives and things I want to focus on outside of employment, that's fine. It is based on, the IPP is based on the services that you need and prefer. So you can relay to your team that there are other goals that you are considering, not just employment. But it should be the first consideration unless you say otherwise. Another area that that the regional center can help you with is post-secondary education, college, technical or vocational training, and even internship programs may be considered to achieve career advancement and getting into that integrated employment setting. And I'm going to go over more of that too. There's actually a name for it, the Paid Internship Program, or PIP, because as if we don't have enough acronyms to work with. So this is just a general layout overview of the kinds of services, transition services, that you can get from the regional center. And that includes, for example, help with living arrangements after you turn 18 years old, supports for becoming more independent, like training, even social recreation. That's actually been a service that's been getting a lot of attention lately. Financial assistance under certain circumstances, training, advocacy and information, and more. This is a non-exhaustive list. So these are examples in the law of what kind of help you can get from the regional center, but it doesn't have to be only that which is described here. It can be more, it should be based on your individual need. So one service I wanted to go into that falls in that whole helping you live more independently is called supported living services, SLS for short. What are they? Well, these are services provided, funded by the regional center, where they send out someone who actually helps to provide you training or going through the process of how to maintain your own home and your own apartment. So the idea is that if you've got your own place, but you need help trying to stay on top of things, trying to manage your own home, like budgeting or cleaning or all that other stuff, an SLS worker is supposed to help you with that, with a specific laid out schedule and types of assistance that they can give. And that SLS cannot be denied based solely on the nature or severity of your disability. So if you hear at all about the regional, if from the regional center or anyone else, like, no, it's too, you won't benefit from this. Your limitations are too severe. That is not true. You have access to SLS regardless of the severity of your disability. And it has to be tailored to your needs and preferences. Now that said, there are requirements to getting SLS. So to be eligible for it, you, either you or your child, whoever the client is of the regional center, must be at least 18 years old. You or your child have in some way expressed a preference for SLS. Like, I want something like SLS. You know, you relay that to the regional center through your service coordinator. And very importantly, you or your child are actually living in your own home or apartment that you own or rent. That being said, although you have to be at least 18 to receive SLS, you can actually get an assessment done. And in fact, that's usually that's how it's supposed to be. You get an assessment for SLS, because how can we know what kind of areas you need help with unless someone meets up with you, talks to you, and assesses you for the areas that you want to improve on. So you can actually start off an assessment before turning 18 and then transition into SLS. But you still need to have your own home or apartment. And I'm going to cover more of that in the following slide. So examples of what counts as SLS supports. So like I mentioned before, an actual assessment being done. Which areas do you want to improve on to help you maintain your own space? Actual help in finding and maintaining a home. So SLS can even start off before you actually find a home. But again, usually there's kind of like a period from like one service to another, but it does include finding one too. Development of employment goals, because the best way to afford your own place is to usually have your own employment. So employment goals are also something SLS can help you with. Social, behavioral, and daily living skills training. And even actually hiring your own staff. So if you've got on top of the SLS other support services that you can access, they can actually help you in how to train or hire or even fire them to provide that care for you. They can provide assistance, like not just in the home, but also how to participate in the community, like volunteering, doing stuff out with other people, all kinds of stuff. Even securing adaptive equipment and supplies, and more. Like I said, the list is non-exhaustive. There are examples listed in the law, but they're not the only ones. The regional center should consider if SLS can provide additional supports that help you maintain your own home. Now, I mentioned before, though, and I as I'm repeating over and over again, own home, own space. Okay, so what does that mean? Okay, so accessing SLS and having your own home. The individual program plan, that whole IPP, is the process that where you make that you work out SLS eligibility. Once you work that out through the IPP process, the regional center will contract with a vendor, a provider, who sends out an SLS worker to help you, assess you and also figure out, okay, in what ways can I train you to live more independently in your own home? And what's interesting is that I said before, it could be, usually it's the regional center, with a contracted agency that sends a worker out. But what if you're thinking, I have another person in mind who I really think would help train me in living in my own home? Does that have to be with some agency that the regional center has hired that sends out some stranger? No, it doesn't. So you can actually have a role in who you choose to be the SLS worker. So you could go through an agency that's vendored with the regional center, but you can also choose like a family member or a friend, as long as you get the approval of the rest of the team and the regional center. So it's not a unilateral thing. You do have to give a heads up to the regional center and get their approval. And you can even coordinate the services yourself. The regional center, now going back to the whole owning your own home, one question that has brought up is, well, what about rent? What about mortgage payments? Does the regional center help pay for that? Unfortunately, no. The regional center cannot pay your rent, mortgage, lease, or household expenses. There are exceptions. So if the payments, for rent and such are required to meet your unique and specific care needs as described in your IPP, and so there's more, your condition presents a risk to the health and safety of yourself or another person. And, I want to give an example where someone actually was able to get the regional center to subsidize rent payment for them. So this individual was an adult man. He actually had his own apartment, and he was working a job and making money, helping to support himself. He was also getting SLS services. So on top of working his own job and owning his own place, apartment, there was an SLS person who came out, helped him to, figure out how to manage his chores and how to budget for expenses. And just to be clear, they're not doing it for you. They're helping train you so you can eventually get better and better at doing it yourself. But then, well, this was right around the pandemic. Things were in turmoil and he lost his job. Things were closing down. And so now this man no longer had an income coming in. And he was at very real risk of being evicted from that apartment that he had worked so hard and set up those SLS supports for to assist him. So there was that risk of, oh my gosh, this person's going to be out on the street, or he's going to end up in a group home, completely restrictive, with a bunch of other people. It's not the ideal. And it would take him a long time to get back to where he was, if he gets back there at all. So we were like, regional center, are you going to let this person let all that progress be undone because of circumstances outside of his control? Can't you continue paying for his rent, at least for a temporary period, until he's back on his feet and finds another job? And the regional center agreed, on the condition that he was making active effort to find employment. So he was regularly updating the regional center. Regional center agreed to cover his rent. And that was how he was able to keep his apartment until he was able to find additional financial assistance. So just giving you one of those situations where that exception did apply, where the regional center covered that rent. Otherwise, generally, don't expect the regional center to fund the costs of staying in your own apartment or home. Now, you may be wondering, well, what if I don't have my own apartment or home, but I still want that help in learning how to live independently, getting training on important skills. Is there anything that can do that? There is. And that service is called Independent Living Skills, or ILS. And Maricruz actually mentioned it when she was going over the transition plan with the school district. So it turns out regional centers, they provide independent living skills training too. So these are skills that are important for you to live independently in the community. And what's also important, you can get ILS in any setting. So if you're thinking, do I have to have my own home or apartment like with SLS? No. With ILS, you can get it if you're living in your parents' home, your siblings' home, in a group home even. You don't have to actually own your own place to get help with that training in independent living. And so how independent living, how it works is there's like an independent living program. They're vendored with the regional center, usually. And then they send someone out to provide ILS services. And that includes helping train you on a whole range of different skills based on what you want and what you need. So here's a list of examples: cooking, cleaning, shopping, meal prep, money management, how to use public transportation, and even going beyond, and even going outside in how to get involved in the community. Also, how to be aware of safety resources in the community. So again, just an example of what an ILS worker can help train you in. And the requirements for getting it, as with SLS, and you have to be at least 18 years old. Once again, an actual assessment for ILS can start beforehand. And if ILS will enable you to live independently in your own home, or at least achieve greater independence while living in someone else's home. So notice that whole requirement about having your own home, it's not there. Not this. That's what distinguishes this from SLS. Now, I do want to bring up an important factor that is going to play a role whenever you request services from the regional center, and that includes transition services. And so what's important to take in consideration is what is called generic resources, or even generic agencies. And you're thinking, what are those? How would that in any way affect me if I'm asking for services from the regional center? Well, it's important because the regional centers are actually prohibited from purchasing services that you could get from some other agency. And those other agencies that provide them are called generic agencies or generic resources. So if you're wondering, if you've ever heard the phrase, oh, we the regional center, we are the payer of last resort, that's what they mean. They mean, oh, could you get the same or similar service from like the school district or from the Department of Rehabilitation or from your insurance? Well, go through them first. Go work it out with them. Only when you can't get it from them, then you can come back to us, the regional center, and ask for help, because we are the payers of last resort. So, and below are just examples of the most typical generic resources. So Medi-Cal, Medicare, in-home supportive services, IHSS, that are from the county. The Department of Rehabilitation, which we will cover later in this presentation. And the school district, which Maricruz covered earlier in the presentation. Those are actually generic resources that you are supposed to go through first before you can ask for the same service from the regional center. Now, if you're wondering, well, what happens if I don't even know what generic resource is available, and the whole process of even applying for it takes time? You know, it's not if I'm applying for IHSS, for example, it's not going to be a quick one and done thing. There's an application process. There's usually an assessment, all that stuff. And in the meantime, what happens? I just get nothing until I may get approval for that service from a generic resource. What do I do? So what you could do is that you can actually request the regional center to pay for the service that you need while you are trying to figure out if you can get that service from a generic resource. So basically get it while pending a final decision or commencement of that service from some other agency. And again, throwing another example out there, I did have a client who had a very young child who was eligible for nursing services from Medi-Cal, from the California Children's Services, but they didn't have a nurse available. And so, or at least they didn't have enough nurses to cover all of the hours. So we were like, well, geez, while mom is waiting for Medi-Cal to find more nurses, what's going to happen? Her child still needs that nursing support. So we actually turned to the regional center and said, regional center, mom, she's not able to get all the hours right now that her child needs from Medi-Cal. So while Medi-Cal is searching, could you help us out here and contact your nursing agencies that you're vendored with and see if they can send someone to fill in the remaining hours? And they did. So just giving you an example of where that whole gap coverage came in. Okay, so I mentioned before that one of the kinds of services you can get help from the regional center on is actually getting into a paid internship. And there's and they even have a program creatively called Paid Internship Program. So how this all works is that the agency that oversees all the regional centers, and that agency is called the Department of Developmental Services, DDS for short, actually gets money. They get funding to actually help work with the regional centers that they oversee to set up a paid internship program just for consumers like you or for your children. The program is supposed to provide incentives to a service provider who actually will arrange or locate an appropriate paid internship for you. So it's basically someone is given the encouragement and the incentive to actually look around and be like, okay, what's a proper stable paid internship that works for you? And if I am able to get you into that paid internship, I benefit as well. That's the service provider perspective. It's available to all clients of the regional center who are 18 and older. And that includes, and even if you are still a student of, let's say, so if you're like, wait, I'm still getting services from the school district, don't worry. If you're 18, you're eligible for to pursue the paid internship program. You can actually participate in more than one paid internship. And that actually would make, which would make us especially make sense if like each one's like part-time and you need to you want to have like a combined full-time thing. And to get started, just ask your service coordinator. Every regional center is supposed to have information and resources about how to go through their paid internship program. They all should have some vendor or agencies that they're contracted with specifically to help locate or arrange paid internships. There actually were some recent updates to the paid internship program, and it was as recently as 2021. But what they are that you can't work more than 1,040 hours per year in that paid internship. So there is a limit as to how many hours in the whole year. You have to be paid at least minimum wage. So no sub minimum wage shenanigans. You are paid at least the minimum wage. The internship or job is in an integrated work environment. So like Maria had mentioned before, actually working with other people, including those who do not have disabilities. That's what they mean by an integrated environment. And it's the regional center that must pay for all employer-related costs. And I actually put a link to a flyer from one of the regional centers advertising the paid internship program. This is Inland Regional Center, but they specifically say IRC will fund the cost of the wages, workers' compensation, and any additional expenses. These wages are paid through a financial management service that acts as the employer on record. IRC reimburses the FMS for all expenses. So FMS pays this, regional center pays FMS, therefore no cost to the business. So again, another incentive to have these, another incentive to employers to actually set up a paid internship for you. And this is just more for like why, and in what way the service providers who find the paid internships for you are encouraged to find a suitable paid internship, because you don't want to go with like just any low skill or whatever type of role that might end up exploiting you or something. Actually having something where they will likely lead to long-term employment or at least develop important skills. So these incentives are, the regional centers will actually pay to persuade a service provider to locate employment for individuals like you who have disabilities. The regional centers will pay that service employer who are able to find a stable paid internship or even job for you. So for example, if let's say that service provider finds a paid internship where you're still there working for 30 consecutive days, well, that provider gets $750. That's their incentive to make sure that it's not that you not only get a paid internship, but that it is consistent and stable. Even longer, 60 consecutive days, they get paid $1,000. So just giving you an idea of like how this whole incentive thing is supposed to work out with the paid internship program. There's more information about not just paid internships, but also employment type programs and resources from DDS, and I put that in the link. I put the link there. Okay, now I did also briefly mention, are there transition services where the regional center can't provide? Yes, and these slides are my best to break that down and as clear and as straightforward as I can. There are services where if you fall under certain criteria, the regional center can't pay for. So if you are 18 to 22 years old and you are still eligible for special education, and that means you haven't gotten the diploma and you haven't gotten a certificate of completion, then the regional center is actually prevented from funding 5 types of transition services. And the 5 are listed below: day programs, vocational education, work services, independent living programs. Remember ILS? Turns out there might be a restriction if you are 18 to 22 and you're eligible for special education. And number 5, mobility training and related transportation services. If you're in a situation where you have left the school system, but it's not clear that technically you could get services under special ed, but you've left the school system, an option is you can ask to return to obtain those services. You can also let the regional center know and see if they can gap fund, remember gap funding, those supports and services you need until or if the school district actually steps back in. Now, I just spent the last slide talking about, oh, you can't get these services if you're 18 to 22 and you get special education. Turns out there's exceptions. So there actually are situations where you can get all those services I just said you can't get if you meet these exceptions. And these exceptions are important. Be mindful that you actually fall under it and may end up getting those services I just said you can't get. Are there exemptions or exceptions that allow the regional center to pay for the transition services, the 5 of them in the last slide? Yes. It is granted if the following applies. Your IPP team, you, the regional center, other people in your group, in your team, determine that generic services are not appropriate to meet your needs. Remember when I went about the whole generic resource thing? You got to go through generic resources. Here comes back in here. Generic resources are actually not available for you. And that includes the school district. So that's part number 2. The IPP team determines that your needs cannot be met by the educational system, AKA the school. So basically, that generic resource, the school district, turns out they don't really have services that meet my needs. They're not the same or similar, or they don't have transition type independent living skill services. And very importantly, participation in a paid internship program. So remember how I said that as long as you're 18 years old, you're eligible for paid internship program. The great thing is that if you're in the paid internship program, even if you're between 18 and 22, and you're eligible for you're still getting special education. If you're in the paid internship program, all those services that were barred in that last slide doesn't apply. You can access all those, the day programs, the work services, the independent living skills. So really important that that exception there. And the regional center should tell you about this stuff. They should be upfront about that these exemptions and exceptions exist, and also the process for getting one. And also, and if there's a situation where you're like, well, if there's a generic resource, I don't know what it is and how to get it, you can actually request a regional center to help you with that. And the regional center has to help you in accessing that resource. And as before, I'm going to throw in another example. I did have a client where he was 18 or 19 years old. He was still getting services from the school district. And he and his mom really wanted him to get independent living skills or ILS training. So he asked for it from the regional center. Regional center said, no, go through your school district. Your school district should provide something like or the same thing as our independent living skills program. And so they connected with us. We followed up with the regional center and explained to them, look, so context, this was right in the middle of the pandemic. So that was when everything was closed, when the schools were closed and their programs were closed. So we were like, regional center, all the school programs, including any kinds of transition service training is closed. So that generic resource isn't available right now. So we are turning back to you, the regional center, and re-requesting independent living skills. Are you going to provide it? And if not, give us, information about how to appeal your decision. And the regional center approved it. So just giving an example where that situation came up or an exception applied. And I'll move it back to you, Maria.
Thank you, Emily. So now we're going to talk about the services that are available through the Department of Rehabilitation should the student have a vocational goal or think that he or she may have a vocational goal. They're called pre-employment transition services. And you're going to want to invite Department of Rehabilitation to that transition planning meeting with the school district. And if you're a regional center consumer, you're also going to want to invite the regional center to this meeting and subsequent meetings. You don't have to apply for pre-ETS. It'll be reflected in your transition plan as to what services you're going to be getting from Department of Rehabilitation. Next slide. So what are pre-ETS services? One area is job exploration counseling. As a student, I'm going to be listening to people about what the options are for jobs. I'm going to be listening to people speak about their jobs. Maybe they come and they talk about their jobs. Labor market, what jobs are hot right now, perhaps career assessments. assessing me for the type of career that would best suit me, and mentors. The second set of services, if you can switch to the next one, is work-based learning experiences. So I may want to shadow someone in their job, meaning I will go and observe them do their job, volunteer, or participate in a paid internship program or in summer jobs. Next slide, please. Counseling and post-secondary education opportunities. Maybe I'm going to hear people talk about different schools, colleges, trade schools, etc. Take college level classes or attend summer programs, or part of this service may include visiting campuses. Next slide. Work readiness training. Perhaps I need some training on social skills or understanding instructions, know what it is, know why it's important for a job to be punctual, learn how to plan, how to get ready for work, how am I going to get to work? So that's transportation. Perhaps they'll help me with my resume or my interviewing skills. Next slide. Instruction and self-advocacy is another set of services. Perhaps they'll teach me how to become more confident, how to make the right choices for me, how to know my rights, what community resources are out there, and how to challenge a decision. If I'm denied a service, how do I go about challenging a decision? Next slide. So that's those are the services that are available to students pre-ETS services. Now, if you want to become a client of Department of Rehabilitation, it's not automatic. You have to apply. So when you become an adult, you can apply online. You can call the local office, attend an orientation. Department of Rehab has 60 days to make an eligibility decision, 90 days to develop an individualized plan for employment, the IPE. On our website, under resources, we have all of our publications, and we have a whole section devoted to Department of Rehabilitation. We have the state contract to help people who are clients of the Department of Rehabilitation or want to become clients of the Department of Rehabilitation and are having troubles. It's called the Client Assistance Program, CAP. So if you find yourself in one of those two situations, you can contact Disability Rights California and ask to speak to one of our CAP advocates. Next slide. So with the Department of Rehab, you're now going to have an IPE, and you're going to notice that it's very similar. You know, it's like all of these plans have similarities. The IEP from the school, the IPP from the regional center, the IPE from the Department of Rehab. You're going to have goals. You're going to have timelines. What are the steps to reach your goals? What are the services? Who's going to provide their services? And how are we going to check along the way that you're on your way to meeting your goals? And it's all based on your choices, just like the IPE, just like the IPP. Next slide. Okay, we're going to talk about disagreements and hurdles. Okay, especially when you're working with different agencies at the same time, you might feel like when they're pointing the finger at each other when you ask for help. What you do is you invite all the agencies to the table, and you figure out what services you need and who's going to pay them. It's going to be in that transition plan. Sign releases so that they can talk to one another about you and your transition planning. Get them all to the table, schedule that meeting and subsequent meetings. If there's an agency that denies a service, get a notice so that you understand what your appeal rights are. You can always contact us also. Next slide. How do you solve a problem in a less formal way? I always say so for example, if we're talking about a regional center issue, start with your service coordinator. And if you're not getting anywhere, talk to the supervisor of that service coordinator. If not, then maybe talk to the program manager, go up the chain of command. With respect to school districts, find out what their alternative dispute resolution is. We're not talking about, filing a complaint or filing for due process for the school. We're talking about the district may have its own ways of trying to resolve issues. So you can reach out to the district and find out what their alternative dispute resolution process is. But, the time to file an appeal or the time to file a complaint is still running while you're still trying to sort it out with the school. So don't be fooled in thinking that, because you're dealing with the school under its alternative dispute resolution, that you don't have to worry about the timelines for appealing or for filing complaints. You do. Keeps on ticking. If you're going to have a meeting with an agency, bring a friend or family member to the meeting. Always ask for an explanation, especially if something's being denied in writing. Excuse me, that family or friend that you bring to the meeting can also be a note taker. And like I said, go up the chain of command. Next slide. More formal, you can contact us to help you with your problem, hopefully help with your problem. We have a sister organization called the Office of Clients' Rights Advocates, or OCRA. For every regional center, there's a client's rights advocate and an assistant client rights advocate to advocate for consumers of the regional center or people who want to be consumers of the regional center. They are not employees of the regional center. OCRA is DRC, DRC is OCRA. The only difference is that OCRA, they specifically help regional center consumers or people who want to become regional center consumers, not only with issues involving the regional center, but also Social Security, Medi-Cal, special education, the things that we do. DRC also has a unit, and we have advocates and attorneys who help with regional center issues too, and we have other units that help with special ed and public benefits, etc. A more formal way is to file an appeal, right? You get that notice of action, you file an appeal, read the appeal, because the appeal should tell you how much time you have to appeal, where you need to appeal, where you have to send that appeal. I've spoken to a number of people who have received notices, and I've asked, well, have you appealed? And the response that I've gotten is, well, I don't know how to do that. Well, at that point, I realized that they haven't read the notice, because the notice would tell them how to do it and when to do it, by when to do it. If there are public meetings concerning an issue that you have, go attend the meetings, voice your concern, reach out to your representatives for assistance. Next slide. The way you can contact us, we have an intake unit. The 800 number is there. And our website is in that link. And if you don't know who your client's rights advocate is for your particular regional center, for Northern California, you can call the 800 number that's there, or Southern California, the other 800 number. Next slide. So we have come to the end of the presentation, and we're ready to take questions, comments. Your questions. Thank you, Mighty Cruz and Emily and Raymond and Lonnie, for everyone. And I guess that's it.
Yeah, thank you everyone for attending. We appreciate you spending your afternoon with us. Big thank you to Disability Rights California, our interpreters. And as a reminder, we'll be sending up a follow-up email tomorrow with this presentation and the materials. And have a great rest of your day, everyone. Thanks for being here with us. Bye.
Thank you.
Hi, everyone. Have a good evening.
Thank
Bye-bye.
you. Goodbye.
Bye,
Thank you so
Maricruz.
much. Yes, email will have resources.